Okay, so again, I am a psychiatrist in Columbus, Ohio, and why do they ask me to come give a talk about impaired physicians? I remember when I was a second-year medical student, I was sitting back wanting to learn about all the arteries and veins and how I'm going to get through the next exam, and wanted to spend time in the library memorizing all this stuff that I'd have to regurgitate. And a lecture like this, I probably would have slept through or spent time studying in the library. But if you look around the room, statistically, anywhere from 10 to 20% of you or your colleagues may at some point experience either mental illness or addiction or alcoholism that may interfere with their ability to function and their work and actually lead to some board involvement. And not everybody is as fortunate as the student who just talked before me and is able to get sober at an early age. So why are we as physicians or medical students kind of looked on so specifically in regards to needing to stay clean, sober, and if we do have mental illness, really needing to keep on top of things? Well, basically, we're pedestal professionals. Society in general holds us up on a pedestal, and because of that, we really have a lot of important things to take care of in regards to patient care, in regards to our own well-being in order to do the job effectively. And, if we were an average Joe plumber, it may not be as important for us to maintain complete sobriety and if we had a problem. But if you're a physician, the medical board really wants you to be able to do your job well and not potentially put other patients or the society at risk in general. So actually the prevalence rate among professionals may be higher than the general society in regards to mood disorders. That's one statistic. And in everything else, we're really at least as likely as dysfunctional as regular society. So what does the medical board consider impairment? Well, according to them, they're the ones that hold my license, and at one day will hold your guys' license. Impairment means an inability to practice according to the acceptable and prevailing standards of care. So this is related to chemical dependency. I'll get to their definition on mental illness a little later. But in regards to chemical dependency, this is a big factor, acceptable and prevailing standards of care. The thing with substance abusers, though, even if you don't drink daily or have withdrawal symptoms or meet criteria for alcohol dependence, that doesn't necessarily mean the medical board's not going to get involved. Because of the nature of addiction, it's progressive. They look at alcoholism and addiction as much more severe than maybe a major depressive episode, because most people at some point, if they don't get treatment for their addiction or alcoholism, are going to have multiple consequences that could potentially endanger themselves or the lives of their patients. Brief history of impaired physicians. Dr. Glover, he was an anesthesiologist who discovered the anesthetic properties of chloroform. And ironically, he died at the age of 43 from consequences of chloroform addiction. Dr. Halstead, a surgeon that pioneered the methods that led to the introduction of general anesthesia, he initially became addicted to cocaine. Back in the day, cocaine was pretty highly touted by Sigmund Freud, and so a lot of docs got addicted to it and had a lot of consequences from it. So he kind of switched to morphine later in life and had some difficulties with that as well. And, he actually died from consequences of morphine addiction, and Dr. Osler probably enabled him. Dr. Osler said he never took less than 3 grams of morphine a day. Dr. Bob, as was discussed, he was the co-founder of Alcoholics Anonymous. The actual date that Alcoholics Anonymous is considered to be founded was the same day that Dr. Bob took his last few sips of alcohol, and Bill Wilson, or Bill W., helped him kind of get through his early state of sobriety. And he remained sober until his death in 1950, colon cancer. So what are the statistics? Again, physicians suffer or have at least as much alcoholism and addiction as the general population, which is up to 15%. Our drug of choice is alcohol, but people in the medical profession, if they're not using alcohol, they're abusing opiates more than any other profession. But in regards to illicit substances such as cocaine or other types of illicit substances, we're less likely than the general population to abuse those. Again, alcohol is the drug of choice. 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 Alcohol is the drug of cho